Hi, good evening. Steve Adler. Got a minute? So let's go over some of the numbers that we have here tonight. This is an important week. We're kind of assessing where we are. We'll be assessing the kind of conduct that we saw the last couple weeks because, as you recall, we were kind of screaming into a higher place, getting really concerned about intensive care units and the like. So let's take a look at the numbers. We are now at a 7-day moving average at 74.8. The new admissions today, 73. The reason that there was a big jump is that over the last week, I think we kind of changed the reporting. We were getting it from the hospital. We were not picking up some of the data. We have all the data in now back filled with numbers, and that gets us up to 73. That's an important number because you'll recall looking at that risk chart that we see, we're in the orange zone, but when we pass 70, as we now have done, we have to take a look, and Dr. Escott will tell us if we've moved into the red area or not. Crossing 70 doesn't automatically put us there, but it's somewhere between 70 and 123, we would move into the red area. How do we know if it's 70 or how do we know if it's 123? That depends on the speed with which we hit it. So if we get to 70 and we're just screaming with new increases, a really fast rate, then at 70 we might need to take additional action. That's quite frankly where we were a couple weeks ago. We were just screaming up in terms of numbers. But then we really had the community focus on trying to change that trajectory. And I don't know what your observations are. Mine is that more people are wearing masks right now. Probably more people are staying at home, having gotten that information. People are focusing a little bit more on social distancing. We're going to hear from the experts tomorrow and at a city council meeting on Thursday. Thursday is the big day. And we'll get the advice from the doctors and from the scientists and the modelers and from Dr. Escott to tell us whether we need to move into the red zone now that we've passed 70, or if we have a little bit more time to continue to change that trajectory, maybe to see if we could avoid it altogether. We need to do whatever it's going to take to protect the doctors and nurses in our hospitals, in our ICUs, but we need to find out when it is that we need to act if we need to. So those are the numbers. 73 today, 74.8 is the 7-day average. Of significance there is that today's number is below the 7-day average. We've been going through a period of time, as you recall, where every day we were at a number that was higher than the 7-day average, and that indicates a pretty steep increase. The fact that today's number, new admissions today at 73, is lower than the 7-day average is a good sign for us. Let's take a look at the total number of cases. It's on the right side, 482 cases. The 7-day average is 411.6. So number new cases today, significantly higher. You know, part of what we're seeing in new cases is that some of those 482 are actually cases where someone was tested as much as 10 days ago. That's because we have so many people taking tests, the labs are just overwhelmed. And in our extreme cases, the results are not coming back for 7, 8, 9 days. That's problematic on lots of levels. When someone doesn't find out early enough that they're infected to know to isolate, which is why we're telling people now, if you get tested, assume you have it if you have symptoms, and just isolate until you get a negative result. But that's the position that we're in. So that 482 may be artificially a little bit high, given the fact that it's bringing in tests from 8 to 10 days ago. Of significance, I think, is the doubling time. So right now, the number of new cases in our city doubling every 25 days. You'll recall back in March, when we took our initial action, we were doubling every 4 or 5 days. We had gotten to the place with tamping down the virus that it was doubling every 42 or 43 days, somewhere in that range. That's when we were slowing it down a lot. Here recently, it wasn't that long ago, that our doubling on new cases was getting down to, what was it, like 12 or 13 or 15 in that range. It had come down pretty far. I'm looking here, 16 and a half on the 27th. It was down at, we were doubling every 13.8 days as of June 30th. So the fact that we're now slowed down the rate and we're doubling every 25 days, also a good sign that that looks like we're bending the trajectory that we were on. Congratulations to everybody in the city so far. We've started this effort in a way. Let's see what the experts tell us on Thursday. But you know, to me, driving around, I see more people wearing masks. I see more people taking this seriously. Down at the bottom of the page, the number of people that are hospitalized, 7-day average, 432. We'll see on the next dashboard that the number of people actually hospitalized tonight, 469. So we're still above our 7-day running average there. In ICUs, the 7-day average, 144, you can see. The actual number on ICUs tonight, 148, which is close to the 7-day average. That's a good sign. On ventilators, 74 is our 7-day running average. We are now up tonight with 89 people on ventilators. That's a concern for the number of people that are increased. You know, we have first the cases anywhere from 3 to 10 days after an infection. We have hospitalizations 2 or 3 weeks after infection. We have ICUs that then usually follow someone that's been hospitalized, could end up in the ICU. And then after that, we have vets. So they're trailing indicators. And this peak may be working its way through our system. That is certainly the hope. Why don't you go to the next dashboard page, Anita? 469 people in our hospitals. We can see that in the middle in green, the 148 and the 89. Those are the numbers I just went through. The number of cases today at 482 brings us to 12,408. Take us over the 12,000 mark. It's a significant one. Yesterday we had 144 people that passed away. Tonight, 151 people. 7 more people have passed away. And again, you know, it's important, I think, that we pause when we get to that number because, again, and we talk about this, that represents real people, real families tonight that are mourning the loss of someone that is much loved. That's why we're doing a lot of what we're doing right now to try to make sure that there are no preventable deaths. Okay, let's look at the next chart just real quickly. I'm going to run by some charts. It's been a while since we've taken a look at Dr. Escott's charts, but just so that we can see those. This first chart is the one that gives us new admissions. The blue line is the actual number charted out by day on new admissions. The yellow line is the 7-day running average. And you can see that line was steeper, more up and down in the mid-June period of time. And now here recently, you can see that line, while still going up way too quickly, looks like it may be flattening out just a little bit. That's what we talk about, taking the trajectory from something that's straight up and down to something that's bent over a little bit more. Still really too early to tell, but that's the kinds of things that we continue to watch. Why don't you go to the next chart, Anita? This is the chart that talks to us about hospitalizations, also intensive care unit admissions and ventilator use. The top of the line is the hospitalization. You can see that marked in blue. You look at the orange line. That is the ICU admissions. And then the last is the gray line is the ventilators. You can see that we started moving off the line to something that was steeper with respect to cases. The hospitalizations, that's the blue line. That happens first, followed by ICUs, which is the orange line, began to separate. And then ventilators would be the one that would separate last. We continue to take a look at those numbers. Let's go to the last chart. The last chart is another way of looking at hospitalizations and both hospitalized and total hospitalized and admissions and ventilators. That top line is the gray line. That shows you the number of people that are hospitalized. The gray line that is underneath that it kind of separates from, the one line, gray line goes up, the other gray line comes down a little bit. That gray line that's coming down a little bit is what the model predicted we would be doing right now if we had stayed with the same behaviors we had been doing back in March and April. The number of transmissions that we cut down by that behavior is represented by that line. So you can see that at this point, that's a logarithmic scale. So you can see that the total number of folks that are hospitalized is that number that is right now, as we saw earlier, just north of 450. If we had stayed where we were in same kind of behaviors in March and April, you can see that we would have been at a number that was probably down about 20. That's the difference in behaviors. Now, I recognize you can't last indefinitely with the behaviors we were doing back in March and April, but that shows you where we would have been. You can see how we were tracking that line, that model line, until they started separating from each other about the 1st of May, which is when we started changing the behaviors in our city, when we started opening up the economy. If you look at the blue line, that is the number with respect to admissions. And you can see, ventilators, you can see the ventilator line and how that separates. The yellow line is admissions. And you can see barely the line that has. It's a 3-day moving average. But you can see where the ventilator line is also diverging from the pattern that we would have had if we kept the same behaviors back in March and April. That's what that chart shows us. All right, let's go on to the next chart that we have. This is a blow up of part of the dashboard. If you go to the dashboard and pull out different sections, you can focus down. This is one of the charts you can pull up. It's hard to see this chart on the screen, but it's the one that talks to us about ethnicity. These are weekly hospitalizations by race and ethnicity. Way at the top, that is the Hispanic line, and you can see that last point shows us that 57.6% of the people hospitalized in the last week were Hispanic. That is down from the number the prior week when we were at almost 66, but even still, it is way higher than the percent of folks, almost twice as high as the percent of folks in our population that are Hispanic. Right now here at 57.6. The next line that you see, that's white. That has remained fairly constant, kind of bouncing around. African American admissions, right now the number's at 10.4, which is significantly higher than the proportion of African Americans in our population in Texas. That page and other items you can pull out by ethnicity are on our chart. This weekend, while we're on this page talking about ethnicity this weekend, there's going to be a second community event that's focused on the issue of disproportionality and this virus. It's Austin's Public Health and the City of Austin Equity Office is going to be hosting a Together Against COVID-19. It is a multilingual community conversation. It's Saturday. It's July 11th at 10 a.m. It is free to participate in. It's going to bring people from all across Austin to share information and resources related to COVID-19. It has a focus on racial and ethnic disparities. There's going to be translators there to interpret to and from residents who speak different languages, English, Spanish, Arabic, Burmese, Vietnamese. Residents are going to be able to listen to one another and share their own perspectives. Neighbors who speak different languages and usually can't communicate to one another are going to be able to problem solve together in this meeting on Saturday. Real excited at this effort by Austin Public Health. The goal is to give people an opportunity to share critical information and learn about resources for the communities in our city that are the hardest hit. City and county officials will hear about how COVID-19 is affecting people and residents from those people and those residents. Participants will be able to address family needs, personal needs, prevention, protection, access to testing. It would be great to register. Let's show that banner one more time. Anita, please take a picture of this. Remember this. Go back. By the way, these broadcasts now are on both Facebook and on YouTube so that they can be accessed by people that don't have a Facebook account. Be great to participate in that. Let's go to the last chart that we have, please. This is a chart that I have not talked about yet in these evening broadcasts, but it's on the website, and I just want to point out to everybody that it's there. It's an interesting chart to take a look at. It is on the second of the two dashboards. You can see it there. It's in the bottom left-hand corner, but if you click on it, you can enlarge it. What this is it shows you what's called an epicurve. So what this chart shows you is by bar graph, and the dates are down at the bottom. You have March all the way over to the left and June all the way over to the right. If you take your cursor over on the website over any one of these lines, it'll tell you exactly the date of the line. It'll also tell you the number of people that first felt their symptoms that day, right? So when people give a case, one of the questions they ask is, when did you first feel like you had symptoms? It could be the same day someone got tested. They could say, hey, it was a week earlier when I first had symptoms, but I thought it was just a cold, or I thought it was allergies or something else, and I didn't really worry about it. Well, this is a chart that graphs when it was that people feel like they first had symptoms. And this is a way to compare what we're seeing to events that were happening in the community. You see that big spike there? That big spike roughly corresponds to Memorial Day. The second half of that spike, that tall line at the very top, is what people were feeling on June 9th. Remember that Memorial Day was the 25th of May, that weekend, 24th, 23rd. So somebody who got infected that day might very well be feeling first symptoms in these block of lines that we see that are tall. You can see that the line reached its low point probably in April to mid to the end of April. As we got into May, which is the white dot in the very middle of this chart, then we started seeing lines beginning to go up at that point. That's as we were opening up the economy. It was a lower line, was increasing. And then we got into the period in May, which is when the governor moved to phase 3. That white dot that's just to the left of that tall peak, that's when phase 3 of the opening of the economy hit on June 3rd. And then you can see what the numbers are. On June 15th, we started revising our orders. That's that white dot that is the one that's most to the right. We started revising our orders, started making it so that you could, you have to wear face masks. We started, asserting more powers to to control behaviors, and then you can see what's happened to the numbers. They've started going down. Now, understand that this chart will always go down off to the right, because there'll be some people who get tested positive tomorrow who say they felt symptoms 4 or 5 days ago. So those bars that are all the way over to the right are still going to get filled in by people who get confirmed case tomorrow, the next day, or several days after that. And when you ask what's the first day, so you're not going to see the drop off there to the right as this chart continues to go. It'll come back. But I think that, as we talked about earlier, as we bend this curve, you'll probably see a little bit of a tailing off at that point. I just think that's a really interesting chart. Also on the dashboard, also something that you can take a look at every day, and something that we take a look at every day as we're trying to decide what kind of actions we should be taking in the community. The federal government, the Department of Health and Human Services today identified 3 hotspots in the country that they felt needed additional federal help with respect to testing. The fact that Texas is one of those 3 is good news, because we need a lot more help in testing. At the same time, it's kind of disappointing that when a country is identifying the 3 places most in need, Texas would be one of them. That said, I'm very appreciative of any and all help that can be coming to us now. Interesting to note that the Brazilian president, Jair Bolsonaro, who's somebody who was telling his country that the virus was not particularly harmful, and that it would go away, and that wasn't something to really be concerned about. That's the president of Brazil. He contracted the disease. Told people today that he had it, recognized that at his age it was dangerous. He's in his 60s. First, I want to say that we wish him a speedy recovery. He's another leader that was giving mixed messages to his population. And it's interesting to note that second only to the United States in total number of cases right now is Brazil. It shouldn't take a high-profile diagnosis like this to really get clear messaging to a country. Nationally, there are more signs that more and more people are taking seriously this virus right now. Recent poll, Newsweek, NBC News, majority of Americans say that we open too quickly. 63% say that, 33% feel that we open too slowly. 79% said they're concerned about a second wave. I agree with Dr. Fauci. I don't think we're in a second wave. I think we're still in the first wave. We just tamped it down. The virus was hiding. It didn't have people to jump from person to person. And as soon as we started opening up the economy without making sure that people were wearing masks and social distancing, the virus had lots of people to jump back and forth from. So it just started jumping. And that's why we started seeing the numbers that we're seeing. You know, still too much. This is a political issue. It's frustrating to me when it feels like this is being politicized, both in our state and around the country. You know, it shouldn't be that one party recognizes this as being a lot more serious than the other party, which thinks it's a lot less serious. One party where people are not as inclined to wear masks as the other party, about half as likely as the other party. One party twice as likely to go out and eat. You know, it's I hate it when it's politicized. In our state, I see that our governor was in the news several times today, suggesting that we in Austin were not enforcing the orders. And I just want to address that. It's not true. We haven't done anything to suggest to our folks that they not enforce orders. In fact, the order that I issued made it mandatory and gave a penalty associated with people not wearing masks. You'll recall I was asking the governor to give us that power for a long time, and he wouldn't do it. He had initially said that was the wrong thing to do because people had a liberty interest not to wear a mask. I disagree with that. I don't think anybody has a liberty interest to infect anybody else. I am pleased and appreciative that the governor changed his position and said that we could enforce masks. First 2 weeks ago, were requiring us to do it in a roundabout kind of way, which was unfortunate, but still better than nothing's. That enabled us to require businesses to require people to wear masks. I'm appreciative of that. And then appreciative just last Thursday, when the governor said that everybody in Texas had to wear masks in most places. We've been asking for that for a while. Would have appreciated if it happened sooner, but I'm happy that it happened. But there's been some suggestion that we don't enforce that, or that I told law enforcement not to enforce that. Not true. In fact, we did have someone who is the president of the Police Officers Association suggest that the governor's wording in his order that said police could give a ticket to somebody who wasn't wearing a mask, but also said you couldn't detain somebody who was wearing a mask. Because the governor's order said both of those things. The president of the Police Association said that then our police really can't give tickets because you have to detain somebody to give them a ticket. That didn't make sense to me. Didn't sound right to me. So we got the city of Austin legal involved, working with the police chief to issue an opinion this past weekend prior to the activities on the July 4th weekend to make sure that all the officers on the police department knew that they could in fact detain people for the purpose of giving them a ticket if they weren't wearing a mask. Because we want people to take it seriously. And the fact that it's mandatory and there's a penalty should send a message to people. I'm working with the city manager and others because I would much rather our police department give someone a mask to wear than to give them a ticket, because I think that if that person would put on the mask, that would make them healthier, make the community healthier. But we need to make sure that people are wearing masks. I continue to believe, as I've said from the very beginning, that we're not going to be able to enforce our way with police officers or deputy sheriffs to get this done. There are just too many places. We don't have enough police officers or deputy sheriffs to watch 1 million people to see whether they're putting on a mask or not putting on a mask. Ultimately, it's up to all of us. If someone walks into a room and 80% of the people are wearing masks, more likely they put on a mask. They walk into a room and 15% of the people are wearing masks, less likely they are to put on a mask. You want to do something to actually have a community, show the discipline and the vigilance, wear a mask. If you wear a mask, others around you will wear a mask too. So we continue to push this, we continue to talk this, we continue to enforce this because it's an important thing for us to do. And I'm encouraged by what we're seeing in our community in terms of behaviors. Tomorrow night, we're going to invite someone to come and join us who is somebody that many of you will know of. Many of you will recognize his voice. We don't always agree on policy matters, but he has now had a personal experience having contracted the virus and was willing to come on to talk to folks about it. So if you're around tomorrow night and able to join us, should be an entertaining time. I'm going to conclude with from the mailbag here. I've heard some parents describe that their time with their children sometimes feels like they've gone through like a cute period before and now they're in a feral period. Probably we don't know any parents that feel that way, but maybe now some of the children are also really stepping up, which I love that image and view a lot more, taking chores over for their parents. To wit, here is Rudy, age 4, who is now taking lawn care off his father's plate. I'm sure that his dad did a good job with lawn care, but not anywhere near as cute as Rudy. So I think Rudy has now won the takeover of this job. Good job, Rudy. That is pretty green grass that you are in charge of now. With that, I wish everybody a good night and take care and be safe.